Now, the US and Israeli strikes on Iran have caused widespread destruction. The government says at least 1,348 people have been killed since the war began nearly 2 weeks ago. More than 200 women and children are among the dead, including an 8-month-old baby. 17,000 people have been injured and hospitals have been severely affected. At least 100 healthcare facilities have come under attack. Well, those are just some of the more than 19,000 civilian sites that have been destroyed or damaged by US-Israeli attacks. Dr. Ali Jafarian is Iran's Deputy Health Minister, and he joins us live from Iran's capital, Tehran. A very warm welcome to you. So, Dr. Jafarian, the World Health Organization reports that more than 1,300 Iranians have been killed, as we've said, and 9,000 have been injured in the last 12 days. You are the man leading the medical response. What is the single greatest challenge your doctors and surgeons are facing in Tehran's hospitals right now?
Thank you for the time and good day. If we could talk about the Tehran city itself, there is no major problem for our health services because our health services are very well prepared for every attack, and we are keeping emergency rooms, facilities ready for any wounded people that come to us. Unfortunately, there are a lot of, as you said, there are a lot of, victims which are killed at the scene because they are doing, like, as our commentator says, carpet bombing and bombing, somewhere like a bank branch or neighborhoods, and these attacks made many of our people killed in the scene. As you said, we have now till now we had 1,395 people killed, excluding those who are under the shake down buildings. There may be some bodies there, but as far as we now know, and most of these people are civilians. These are all living in neighborhoods, and in the past 4 days, the attacks to the neighborhoods and city areas, non-military, non-police, and everything else is increasing. So we have this problem.
Okay.
Serving the people who come to us is okay, and we are ready for that.
Okay, can you give us then, because you've described it as carpet bombing, can you give us a number on how many pharmaceutical and medical centres have been damaged by US and Israeli strikes? How many of your major trauma hospitals are currently operating without consistent electricity or medical supplies?
Yeah, we have 31 major clinical facilities and hospitals damaged. 12 of those hospitals are inactive now, and we have to evacuate 6 centers because of the attacks and these logistic issues. On the other hand, we have 149 of our health centers and primary healthcare system damaged. And 100 of these centers are damaged in the past 4 days. So that means that they are doing carpet bombing, really, because the health centers is somewhere that everybody is coming to give the primary healthcare services, like the pregnant women, kids, and so on. And unfortunately, we had 2 of our healthcare workers in these centers killed in the past 4 days. And also we did have 18 ambulances, 4 of them are out of work, 1 helicopter ambulance, which is out of work, and 1 sea ambulance, which is out of work now, and 31 pre-hospital emergency unit systems damaged. 4 of them are now not working at all.
The IRGC recently stated that Iran is prepared for a 6-month war. However, reports from January showed your hospitals were already at a critical phase due to mass internal protests in the country. Was the health system ever truly prepared for a full-scale military conflict like this?
We have had the experience of 8 years war with Iraq, which was the same things, and so we have to evacuate a lot of wounded people from the battlefield to the cities. So my country and our health service is ready for that. We are working on it, and we are doing everything we need for even worse situations. I hope not happening, but the health system is ready for that. Our centers around the world, around the country is more than 1,000 hospitals are doing and serving the people.
Dr. Jafarian,
so we can cover that if needed.
Okay, Dr. Jafarian, you must concede that the blockade of the Strait of Hormuz and the closure, we know now, of Dubai's humanitarian hub have frozen something like $18 million in medical supplies that are precisely intended for this region. Iranian civilians must be asking why the government continues this maritime blockade that prevents international humanitarian aid from reaching its own people. I mean, is the state's military strategy, do you think, more important than the health of Iranian citizens?
I'm not sure that what is happening there, but as far as I know, we are trying to import all of the medicines and equipment and supplies from different routes that we have. We do not have any flight to Iran now, and the southern coast of Iran is under attack several times, even some days. So we have a lot of limitations added to the severe sanctions against us and the money transfer and these issues. But we are trying to reach to all of those sources in different ways and bring them in. We do have strategic support for 6 months. We did it before, and we are trying to replace it as is used.
Ordinarily, you would have had support on your doorstep, but things have changed significantly. I mean, the UAE, Qatar, Saudi Arabia and others have often put aside deep political tensions to help Iran during the COVID pandemic and the 2019 floods. I mean, during the pandemic, they provided masks and ventilators to Iran. Likewise, Iran provided Qatar with food and airspace during the 4-year blockade of the country. Do you now fear, with the attacks against the Gulf countries underway, that your government and military is burning diplomatic bridges and inflicting pain and disruption unnecessarily?
I'm not a political guy, and I'm not ready to answer these questions because it is out of my expertise and out of my responsibility. But the UAE has helped us in the 12 days war with the United States and Israel. They send us a lot of medicines and medical equipments, and we have a good relationship with all of the Persian Gulf and Arab countries.
But do you worry, Doctor, that relationship
after this?
Do you worry, Doctor, that relationship is now no more, that bridges have been burnt, that these old neighbourly alliances that Iran had with the Gulf countries are now completely evaporating before our eyes? I know you're not prepared to answer political questions, but as a medical man, you must see what impact that might have on the ground when it comes to the safety and healthcare of Iranian citizens.
Really, I hope that these bridges be rebuilt if it is destroyed now. I don't think so, but if it is destroyed, it could be rebuilt again between Iran and the Arab countries. We have had a very good relationship for many years, and I hope that we will continue to do that. But as you know, there are a lot of United States military bases in some of those countries, and they are used to attack Iran in this. The Mina school, elementary school, was one example, which was, the tomahawk was used to strike the school on a double tap manner, and this is not, it is insane. And the United States president said that it was Iran that attacked the school, and so on. These are done from the U.S. bases in some Arab countries. So that's made us to attack those bases.
It's just to be clear, it is not verified that these bases are being used to launch attacks on Iran. Multiple Gulf countries have made it very, very clear that they do not want the United States to use their sovereign territory to launch those kind of attacks. But I hear what you're saying about hoping that any bridges that have been destroyed now may potentially, when this war eventually is over, could be restored. Dr. Ali Jafarian, the Deputy Health Minister of Iran, thank you so much for joining us.
Thank you. We hope so.